COPD is a chronic respiratory condition that affects millions of people worldwide. It can manifest in varying degrees of severity and impacts the quality of life for those whom it affects. Therefore, early detection and intervention are crucial for managing this disease and reducing the risk of long-term complications, which is why we created this video to discuss the early warning signs of COPD and provide a comprehensive understanding of the subtle indicators that may point to this condition. Keep watching until the end because there are a few that most people aren't aware of. So, if you're ready, let's get into it. Number 1. Shortness of breath. One of the earliest and most common warning signs of COPD is shortness of breath or dyspnea. This can occur during everyday activities such as climbing stairs, walking, or getting dressed. As the disease progresses, shortness of breath may occur even at rest, making it increasingly challenging to carry out daily tasks. Another common sign to look for is coughing up sputum. COPD can cause an increase in mucus production, leading to the frequent need to clear the throat and cough up secretions. Number 3 is wheezing. Wheezing is a high-pitched, whistling sound that usually occurs during exhalation. It is caused by narrowing and obstruction of the airways, which is common in COPD as the lungs become inflamed and the airways constrict. Another common sign is chest tightness. People with COPD may experience a sensation of chest tightness or pressure, making it difficult to take a deep breath. This feeling is often the result of inflamed or constricted airways, or the buildup of mucus in the lungs. Those with COPD may also experience fatigue or general weakness. This can be due to decreased oxygen levels in the blood, which can affect overall energy levels and the body's ability to perform everyday activities. Number 6. Recurring lung infections. People with COPD are more susceptible to lung infections such as pneumonia or bronchitis. These recurring infections can further damage the lungs and worsen COPD symptoms. Number 7 is swollen ankles from fluid buildup. Swelling in the ankles, feet, or legs, known as peripheral edema, can be a sign of COPD. This occurs when the disease begins to affect the heart's ability to pump blood effectively, leading to fluid buildup in the lower extremities. A chronic cough is another early warning sign of COPD. Often referred to as a smoker's cough, this symptom can be dry or accompanied by mucus production. The cough is usually worse in the morning and may be triggered by environmental irritants such as smoke, dust, or cold air. Number 9 is difficulty taking a deep breath. COPD can make it challenging to take a deep breath due to inflammation, mucus buildup, and narrowing of the airways. This difficulty can result in decreased oxygen intake, leading to other symptoms such as fatigue and shortness of breath. Number 10. Cyanosis. Cyanosis is a bluish discoloration of the skin, lips, or nail beds due to insufficient oxygen levels in the blood. In people with COPD, cyanosis can be a sign of worsening respiratory function and may indicate a need for immediate medical attention. Another sign of COPD that I want to point out is a barrel chest. A barrel chest is a rounded, bulging appearance of the chest caused by chronic overinflation of the lungs, usually related to air trapping. This symptom often develops over time in individuals with COPD when air remains in the lungs during exhalation due to constricted airways and the inability to fully exhale. The next sign on our list is rapid breathing. Rapid or shallow breathing, also known as tachypnea, can be a sign of COPD as the body tries to compensate for inadequate gas exchange in the lungs. Number 13. A reduced appetite and weight loss. Individuals with COPD may experience a reduced appetite due to difficulty breathing, changes in metabolism, or side effects from medications. This can result in unintended weight loss, which may exacerbate fatigue, weakness, and an overall decline in health. Number 14 is a pale, sweaty face. During COPD exacerbations or periods of labored breathing, the face may become pale and sweaty due to reduced oxygen levels and increased physical exertion required to breathe. Another sign to be aware of is insomnia. Difficulty sleeping or insomnia can be a common sign of COPD, as nighttime coughing, shortness of breath, and anxiety related to breathing issues can disrupt sleep patterns. Number 16 is hypoxemia. Hypoxemia is a condition in which there is an abnormally low level of oxygen in the blood. In people with COPD, this can be caused by inadequate gas exchange in the lungs due to inflamed and constricted airways. Hypoxemia can lead to a range of symptoms, including shortness of breath, fatigue, confusion, and cyanosis. Next up is fever. Fever can be a sign of a lung infection in individuals with COPD, as their compromised lung function makes them more susceptible to infections such as pneumonia and bronchitis. If accompanied by coughing, shortness of breath, or chest pain, a fever may indicate a need for medical evaluation. Number 18, difficulty speaking due to a lack of air. During a COP exacerbation or a period of severe shortness of breath, individuals may find it difficult to speak or complete sentences as they struggle to catch their breath, making communication challenging. The next sign on our list is feelings of confusion. COPD can cause feelings of confusion due to low oxygen levels in the blood. When the brain lacks oxygen, cognitive function may become impaired, leading to difficulties in concentration, memory, and decision-making. Those with COPD may also experience feelings of anxiety and panic. This may occur as a result of breathing difficulties, fear of worsening symptoms, or the psychological burden of living with a chronic illness. These feelings can exacerbate respiratory symptoms, creating a vicious cycle that further impairs their quality of life. Number 21 is posture changes. People with COPD may adopt a hunched or forward-leaning posture in an attempt to alleviate shortness of breath. This posture, known as the tripod position, involves leaning forward and supporting the upper body on the arms to expand the chest and improve airflow. Next up is exercise intolerance. COPD can cause exercise intolerance, which manifests as increased shortness of breath, fatigue, and discomfort during physical activity. This inability to exercise can limit daily activities, decrease overall fitness, and contribute to the development of other health issues. Number 23, itching of the chin or neck. Although not a common symptom, COPD can sometimes be accompanied by an itching sensation around the chin or neck, which may be a result of irritation or a subtle indication of respiratory distress. Number 24 is dizziness. Dizziness can be a sign of COPD, often resulting from decreased oxygen levels in the blood or poor gas exchange in the lungs. This sensation of lightheadedness or imbalance may be more pronounced during periods of exertion or when standing up too quickly. Another sign to look for is a dry mouth. Mouth breathing, which is common during COPD flare-ups or exacerbations, can lead to dry mouth as the air dries the oral cavity, potentially causing discomfort or irritation. The next sign that I want to mention is a decrease in peak flow reading. A peak flow meter is a device used to measure lung function, specifically the maximum airflow during a forceful exhalation. A decrease in peak flow readings indicates a decline in lung function and should be monitored by healthcare professionals to ensure appropriate management of the condition. And another sign of COPD is the increased need for inhaler use. An increased need for rescue inhaler use may signal worsening COPD symptoms or poor control of the disease. Frequent reliance on rescue inhalers may indicate a need for adjustment in the overall treatment plan to better manage the condition and prevent further decline in lung function. So as you can see, the early warning signs of COPD should not be ignored or dismissed. Effectively treating and managing COPD symptoms requires a comprehensive approach that involves medication, lifestyle changes, and regular monitoring. By paying close attention to subtle symptoms such as shortness of breath, chest tightness, and wheezing, you can take the necessary steps toward proper diagnosis and treatment. Identifying COPD at its earliest stages not only ensures a better quality of life for those affected, but also helps reduce the risk of severe exacerbations and long-term complications. As COPD remains a prevalent health issue worldwide, raising awareness about these early indicators is critical in promoting timely intervention and ultimately improving the lives of those living with this chronic condition. If you want to support the channel, please like and subscribe. I would greatly appreciate it. And there should be some other helpful videos popping up on your screen right about now that I think you will enjoy. And just a quick reminder, we are not doctors. This video is for informational purposes only. Thank you so much for watching. Have a blessed day. And as always, breathe easy, my friend.